Also with us right now, Congressman Krishnamoorthi, who's a Democratic representative from Illinois. Congressman, good to have you with us this morning. A bit of a late night, I know. So first, let's get your reaction to this bill that passed the House. There is a lot in it. One thing that I am curious about, and full disclosure, it's because a friend texted me his concerns about people who are part of the gig economy, people who are more hourly workers and may not have a regular rate of pay, which is referenced in this bill. Are there provisions for those folks?
So there are various provisions in this bill that apply to workers. I just cover four. One is free coronavirus testing, two, paid sick leave. And there, with regard to paid sick leave, for any employers less than 50 employees, they get reimbursed by the federal government. For any employers greater than 50, then they would be mandated to pay it about 2/3 of the salary. The third is food relief for all people who are indigent and especially folks who are going to be at home, quarantined, unemployed. They're going to need help. And then finally, additional unemployment insurance for the states. With regard to gig workers, I think that they will be able to take advantage of these provisions. Certainly, you know, the free coronavirus testing applies to everybody, regardless of who your employer is. And then, with regard to other provisions, I'm hopeful they'll be able to take advantage of them as well.
Yeah, it is that loss in income, I think, that they are most concerned about, so hopefully they will. We just learned from our folks there in the White House press briefing room, and we're, of course, waiting from this update from the White House's coronavirus task force, that as members of the press were coming in this morning, all of their temperatures were taken. They were told it was out of an abundance of caution. One person was turned away who had a temperature of 99.9. Great to see this happening, right? That there's some concern about anybody who could be coming into close proximity of the president or the vice president. Were you aware that something like this was going to be implemented?
You know, I'm a little concerned about the situation. Just overall, you know, we're just not testing enough people for coronavirus. I'm glad to see that they're taking temperatures with regard to people entering the press briefing room, but there's a much bigger problem right now, which is that we are way behind other countries in terms of testing the number of people in our country for coronavirus to stop the spread. Just as an example, in Korea, for every million residents, they've already tested 4,000. Here, we've tested 15 for every million residents. So we're far behind. And the fact that the administration, even yesterday at the press conference, the president refused to tell reporters by what date Americans can expect to get the testing they want and deserve, is telling, because they don't want to be held accountable for their promises and claims, and that's very dangerous. A similar thing happened in my hearing when I questioned CDC Director Redfield, you know, by what date are we going to be able to test 15,000 people per day? He wouldn't tell us.
That is a question many people do want answered. We have been told, you know, Vice President Pence earlier this week said there would be 4 million kits by the end of the week. And then the president yesterday saying there would be 5 million by the end of the month. So, yes, we are sort of with you in that confusion there. I'm curious, though, do you have a sense, especially based on your role on oversight, do you have a sense that the government, though, is starting to get a better handle on it, maybe behind the scenes?
I think so. I think that they are trying to get a better handle on it. The fact that the CDC is no longer in charge of making sure that testing happens, that apparently they've now put the Assistant Secretary of HHS, Mr. Gregoire, in charge of it, is a hopeful sign. But the fact that they refuse over and over and over again to tell us a timeline or goals means that either they don't know how to calculate those goals or the timeline, or they know but they don't want to, or they have and they don't want to share the information, so they don't want to be held accountable. Any of those outcomes is dangerous for the American people, because we need to get those tests right now. We are getting inundated with calls from people who are basically saying, how do I get this test? I went to my doctor. I requested the test. The doctor then called and they couldn't get the test. And this is even for people who are in many cases symptomatic, or they haven't been ruled out as not having coronavirus.
Do you think the president should be tested? He intimated yesterday that he was now open to the idea. Then we heard from the White House that they didn't think he needed to have that test done. But do you think even just for the American people, there would be an advantage to the president having that test taken?
I think that's the responsible thing to do. I'm a little concerned about why he doesn't want to take that test. Is it because of that statement that you pointed out his physicians issued, which is that he is at very low risk of contracting coronavirus, or is it that they don't want to know the answer? They don't want to know if he is positive. Of course, that's dangerous in and of itself, not only to him, but to everyone around him. And I think that he should take the test, and I think we should know what the test results are. It turns out 3 people now from that dinner that you talked about contracted coronavirus, and so it makes all the sense in the world for him to take that test. You know, several members of Congress, several colleagues of mine have self-quarantined just because they came into contact with somebody who had coronavirus. Well, it turns out 3 people at this dinner that he attended had coronavirus. So in some senses, he did come in contact with them, and I think he should take the test.
Well, we have, and some of your Republican colleagues, I should point out, Congressman Adam Kinzinger, also Senator Rick Scott, who told me in an interview early today, both urging that the president should be tested. I want to talk to you about kids at this point in school, because I know there are, the last estimate that I saw was at least 21 million kids will be out of school for at least some period of time. In some states, that could be as long as 6 weeks. Other schools, maybe a couple of days. I know that there are concerns there. How are those being addressed, not just in terms of food insecurity, but also in terms of safety for some of these kids, and distance learning, which of course only works if everybody has access to a network and to the technology itself?
Sure. So in Illinois, the governor just a couple days ago ordered the closure of all schools. I think he's one of a handful of governors who've done that. And the reason why he did that, and the reason why the other governors did that, is because there's a very high risk of community transmission from children who carry coronavirus, even if they're not symptomatic. They don't know how to practice social distancing the way that adults do. So then it presents another set of challenges, which I think you're alluding to, which is if they're sent home, who's going to care for them? I think that the legislation that we passed last night is going to help a lot with regard to that issue, because quite frankly, now we are offering paid family and medical leave as well as paid sick leave. And so those parents who have to be at home with their children who have now been sent home because of school closures can get paid at least 2/3 of their current salary, which is very important, so that someone is at home to take care of them and there's security there. But you do raise some good questions, but I think that the legislation last night really addresses that and makes it more possible for districts to kind of pause some of their activities and have an extended school holiday. Of course, as for those parents who have to now be at home with their children all day, those that's another set of challenges altogether.
I was talking to a fellow working mom this morning who said to me, there's a reason that teachers go through a lot of schooling and training to be certified to do what they do. And she said, I am not that person.
Yes,
you know,
exactly.
Also, as we look at this, something that stood out to me on your Twitter feed, you had retweeted an article, and this is something that I've been talking with people about on the ground. I might have to leave it there. I think we're about to get an update from the White House Task Force, so I'm sorry to cut you off there, but Congressman, really appreciate your time this morning. Thank you.
Thanks, Erin.